My name is Dr. Davina Ramsingh and I'm attached with the Ministry of Health for the past 10 years and more. I'm at the Diabetic Center, Comprehensive Care. So in simple terms, diabetes is a chronic disease that affects the way our body converts food into energy. And that energy, most of the times we're getting it from food. So most foods that we eat breaks down into glucose, or as the public know it as, sugars. And those sugars are passed, or glucose are passed into the bloodstream. Now the body has an hormone that we call insulin that helps to make that glucose move from the bloodstream to the cell so that the body can utilize the energy. So usually you will find that persons living with diabetes would have readings, or as you call a random blood sugar, higher than 200. So that's how you know a person would have or at risk of having diabetes, because there's a screening process for that. Now, who's at risk of getting diabetes? It's all of us, because at one, we're targeting patients at 25. So reason why we're using patients at 25 is because one, that's the population age that is at risk of a lot of factors. As we know, we have a lot of unhealthy lifestyle and we're exposed to a lot of drugs and alcohol. So we want to target the younger age. Also, another reason why we're targeting 25 is because we find that most persons coming to the clinic at presently is always in the older age and when they already have the diabetes. So targeted as a younger age in 25 will be able to capture diabetes or to able to prevent it from becoming complicated. Also persons who have obesity or they're overweight, persons who have sedentary lifestyle or not exercising, and you have persons who have family history of it. So those are persons you want to look out for who may be at risk of diabetes. Now, there are symptoms that you can look for, but not all patients present with these symptoms. We might say a term you might hear, they say asymptomatic, meaning that they're not having any symptoms. But there are 5 main symptoms that we look at, and that's a lot of urination, excessive urination, you have excessive thirst, you have persons that might complain of itchy skin, or you have some person might say they're eating a lot, and you have some persons that may say they lost a lot of weight. However, they have had some persons that have expressed that they might feel nauseous, or they've had a wound to any part of their body and it takes a long time for it to heal. So those are little areas that we look at to put a patient at risk of saying that they might be diabetic. So I want the public to understand that diabetes is not just looking at a person and say, yeah, you might have it. It's about you getting screened.